90% of eye disease is preventable, treatable, and reversible. So we have a very, very coned down conditions where we say, no, we cannot do anything. But most today with the modern science, with technology, with genetic modulation, immunotherapy, cancer therapy, we can treat everything.
So we try to kind of
all these tests.
I retired and obviously, but thankfully.
So going back to a point that you mentioned within the conversation, but I want to touch up on it. You mentioned laser treatment. So first off, what is the difference between LASIK and laser, and when is it necessary?
So as I told you, myopia is very common and it's growing. Laser treatment is for correction of glasses.
Okay.
So, for example, first of all, it's a cosmetic treatment.
Okay.
You can very well stay with your glasses and contact lenses. The reason you do laser is for two reasons. One, you want to get rid of glasses. You are fed up of glasses. Number two, you have problem with contact lenses. For example, you are in a profession where you don't need to show that you're wearing glasses, like a presenter, like you, for example. And you develop infection with contact lenses. So you want to get rid of contacts. There's other half of people who, for example, they wear glasses, but they are not able to use good sunglasses, like, for example, many sports persons.
Yeah.
Some of the aviators, pilots, they need laser to get rid of their glasses. Laser and LASIK, they are actually different generations of laser correction. Laser came first. They were the first generation. We way back somewhere in 90. It started somewhere in Europe and in US. Later on, it became LASIK. Now, LASIK is an advancement of laser. The process remains the same. What we do is we have a laser which corrects the number by changing the shape of the cornea, which is the front part of your eye.
Oh.
So if you are myopic, we just flatten the cornea, it corrects your number. If you are plus power, like hyperopic, we make the cornea more steeper, it corrects it. How we do it is the trick. If we have to make a flap and then lift the flap like a window and correct the numbers, and the window falls back and you get the vision next day, it's called LASIK. Okay? So LASIK is a surgery where we make a flap, we make a cut, and then the laser works.
Okay.
In the other hand, if you don't make that flap and you correct it without making the flap, it's called laser.
Okay.
So laser was the old technique. It used to take longer for recovery. For example, you do laser, you take about a month to recover.
Okay.
Whereas the LASIK, you recover next day, 24 hours.
Okay.
So that's the advantage of LASIK over laser.
Okay. And when do you recommend it?
So, the question is very simple. Anybody who's coming to me to get rid of glasses, I would say, yeah, you're welcome.
Okay.
But there are some restrictions.
Okay.
The restrictions is, are you suitable for it or not? So we let that person go through various investigations, and then we look into it. Okay, your eyes are suitable. It is going to be done without complications, and you don't run complication in future. Because if you are, for example, you are -4, and I'm going to correct you, you have to have a proper thickness of cornea to correct that number.
Okay.
If you have a very thin cornea, you cannot correct.
So there are prerequisites. I mean,
Yes,
not everyone can
yes,
do it.
no.
Okay.
It's not for everybody.
Okay. But there are certain misconceptions around the whole procedure. I mean, I'm sure you've heard a lot of them. Can you maybe mention a few?
Yeah, see, one of the things which people think that laser is very, very safe. You can do it anywhere. It has no problem. The answer is no. Any surgical intervention in your eyes within the safe parameters, safe. If you deviate from any of the safe parameters, it's not safe. Driving car on side is safe, so long as you follow the rules.
Absolutely.
If you take a Ferrari and drive rash, you're going to make with an accident. If you do not follow the instructions mentioned for each and every individual, you're bound to have problems. So the misconception comes from two things. One, there are people who think everything is safe, and then there are people in the other spectrum who think everything is bad.
Okay.
Both are wrong. It is neither very safe or neither very bad. It is safe. It is done within those parameters, as I mentioned. It has problems. So you need to go to a proper doctor for proper evaluation. And if it is safe, go for it. If it's not safe, choose other objects. Like, for example, you can stay with contacts. You can go for ICL, implantation of contact lens in the eye. So there are various other techniques which may work for you.
Okay.
Yeah.
Okay. I mean, it's important to know that anything in the medical field and in life is never 100% perfect.
Yeah,
I mean, there's always,
There-
pros
there-
and cons to everything.
Yeah.
So could it be reversed, though? I mean, could I actually get this LASIK or laser treatment and then down the line my eyesight deteriorates again?
So there are two things.
Okay.
Again, one is it reversible? The answer is no.
Okay.
So once you do it, you do it. But if you have a regression, for example, you had -4, and let's say 5 years, 10 years down the line, you get back -1 again, back. So we do what is called enhancement.
Okay.
So we can retreat you. So we open the same window again and do the retreatment. It's possible.
Like a
But then you will
touch-up.
have to go through the same process of evaluation.
Okay.
So you have to have enough cornea left. You have to have the enough parameters, which are safety parameters. The shape should be okay. So if we see everything is okay, then we say, okay, you come. We can do the retreatment for you.
Okay.
But if retreatment is not possible, it's better to go back to glasses or contacts.
Okay. And blindness is a topic that we mentioned in the beginning, but I want to go a bit more in depth into that because I think everyone fears it the most, especially if you've had your eyesight for the longest time. So is there any way for someone to reach a point where they genuinely cannot see and it can be rectified, or is it then too late?
So
It's a tricky one, but I'm thinking, I don't know. I mean, is there any condition out there that can be
you're right.
salvaged?
You're right. Yes. Now, there can be blindness of different things. There can
Okay.
be blindness from birth, for example.
Absolutely.
The child is born totally blind. There are certain genetic modulation now available, which we can treat certain blindness in children as well. I'm not saying all types of blindness can be treated in children, but there are different types. So if the blindness is primarily because of a cataract in a child, for example, yes, we can operate the child and make the
Okay.
child see again. For example, if the child is born with some defect in the cornea, which is causing blindness, we can operate the cornea and
Okay.
give the new life to the child. Sometimes the children have, for example, squint, which can also cause partial blindness. We can correct that. Or amblyopia, like lazy eye. We can correct that. As an adult, some of the blindness are preventable. For example, glaucoma. Now, glaucoma doesn't have any symptoms. So you actually don't know whether you suffer from glaucoma. So that's why if you have a history in your family, if your parents, your brother, your sister, somebody is diagnosed to have glaucoma, you must visit, even if you have no problem in your eyes.
Right.
You must go and see an ophthalmologist, tell, okay, my parents have glaucoma, can I have one? Can you check me? So what we do is we check your eye pressure. There's a threshold which we check. If your threshold is more, then we say, yeah, your pressure is raised. So now you need additional tests. Those tests are, for example, we take pictures of the eye, we take pictures of the optic nerve, we do some field test, and then we say, okay, you are fine, you are safe, or we say, no, you are doubtful zone, and you need to do close follow-ups.
Okay.
Cataract can give blindness as well. If you don't treat cataract can mature, and you go blind. So these are preventable blindness, okay, cataract. Correcting glasses, myopia or uncorrected errors, these are preventable. But sometimes we fail. It's there. There are certain diseases which we cannot treat, but there are only very few of them. 90% of eye disease is preventable, treatable, and reversible. So we have a very, very coned down conditions where we say, no, we cannot do anything. But most today with the modern science, with technology, with genetic modulation, immunotherapy, cancer therapy, we can treat everything. So it's not that we have lost hope. We have lots of hope.
I'm happy to hear that. So in terms of prevention, it is preventable. But if it does reach blindness, it's not always rectifiable, is what you're saying.
If your nerves are dead and there is no communication between your eye and the brain, absolutely dead nerve, is it that can you do something for that? The answer is yes. Sometimes we have a new technique where we fit in cameras.
Okay.
So we have these microchip cameras which we can fit in the eye, and that will give you some vision. I'm not saying that you will get everything back, but you can see some shades, and some people can even move around with those cameras. So these are microchip cameras which are fit in the retina and in very advanced cases. But if your optic nerve is dead, can you transplant the eye? Answer is no.
Okay.
So far, we have not reached that point.
Where there's eye transplants.
Eye transplant, no, as a complete eye, but we do cornea transplant,
Cornea
we do retinal
transplants.
transplants, but not complete eye transplant, no.
Okay. Okay. Are there any other technological advancements that you think are worth mentioning, especially when it comes to the eye? Because I know there have been quite a few in the field.
Yeah, I mean, the most important thing nowadays is called the stem cells. So
Okay.
we are talking about that. We think that in future we can have the stem cells, which will probably transplanting in the eye, and it might grow and it might help in blind eyes. But that experiment is still going on.
Okay.
In some stage we have succeeded. In some we are still waiting for research. So I don't know. I mean, medicine is today and tomorrow and then beyond. So I don't know what's going to happen.
It's forever evolving.
Yeah.
Yes.
Yeah.
Okay, Dr. Mitra, we've taken so much of your time, but my last question is, what's your advice for everyone? If you were to give them the golden piece of advice when it comes to eyes, what would it be?
I think it's as an ophthalmologist, I think prevention is better than cure.
Okay.
You should not come to me when you are almost a dead fish to
Okay.
make you alive. So take care of your eyes, eat healthy, stay outdoors. The recommendation is 2 hours a day you should stay in daylight. It really helps. Blue light actually helps your eyes. It's another thing. Good nutrition, good environment, and visit the doctor when you need. So checkups, periodic checkups when it's required, you must do that. But stay healthy, expose yourself to outdoor life, and encourage your children to play out. I think that's the way how you can stay safe and you keep your eyes healthy.
Yeah, reducing the screen time. I think that is the most difficult thing to do with kids these days. Dr. Mitra, thank you so much.
Thank you very much. Thanks for inviting me.